lives in. But the issue is really important to me, and I think Representative Arnie just mentioned the real life scenario of how this impacts everybody. And seeing the great work I know the African American Breastfeeding Network has done in the district, as well as what you've done, Congresswoman, is actually inspired my colleague and I to push legislation on the state level, making sure that doula services are mandated to be covered under Medicaid and health insurance, because again, we want to make sure that access to doula services are affordable and accessible. So I'm glad to be here and be part of this important conversation.
Good morning, I'm Amanda Dreyer from the Department of Health Services. I'm the Deputy Medicaid Director and also a mom of 2 girls. They are 11 and 14. It's going great. Middle school and high school is awesome.
The mouth is.
So we're working on it. We're formulating effectively. Yeah. Learning how to do it well. And as the Deputy Medicaid Director, obviously supporting the programs and the coverage that provide health care to our families and our moms across the state. We've got more than 1 million people who rely on us for good quality services, and that's our charge, is to take care of each and every person and to make sure they have what they need. Really view my responsibility, especially to help find and amplify the voices of the people who use our services, who provide our services, and make sure, as you said, Representative, that comes back as solutions that we are hearing as boots on the ground or coming in from our good partners. So happy to be here. Thank you for having us.
Hi, my name is Jamaica Jones. I'm also a mother of 3. I have 2 girls and 1 boy, 12, 7, and 3. My 3-year-old, he's definitely giving me hormones for my money. They do say gender change is different, and I'm telling you, he's different than my other 2. But he gets the chance to know that motherhood is important. My job here today is just giving me my feedback on what it is using the services of Medicaid and how important it is for motherhood. Because me being experienced here, I'm happy to be here just to be able to voice my opinion about how important it is for every mother in America and all over the world of how important it is for these services. So I'm glad to be here.
Hello, my name is Krishana Franklin. I am a doula. I've been a doula for over 5 years. I am also a mom. I have an 8-year-old son. And I just feel like my responsibility is to help educate, advocate, and support women when they're going through pregnancy and labor and postpartum.
All right.
Hi, my name is Emily Calderon.
Yes.
I apologize that I'm late. I don't drive downtown, so this was it's
Right
very
on
confusing.
time.
A little bit about me. I'm a mother of 2. I'm also a business owner, so I was also a little bit caught up on that. So I apologize. I'm sorry. And yeah, just I've had a good experience with Medicaid, so I just want to make sure hey, it's a good program. Don't take it away.
Okay, thank you. I think a really good place to start is, if I don't know, Representative Arnie, if you don't want to disclose any personal information, but it's very important to know why, what is it, like something like 48, 49% of children in this country who are born using Medicaid. So all of us went, when you said someone was just born the other day and having problems, you can't unborn these people. But with Medicaid funding, and I was wondering, could you share with us just the current, what's happening in real time with Medicaid funding?
Well, in real time, right now, we're coming from behind in the state of Wisconsin in that women who are postpartum are only entitled to about, 90 days? 60 days. And unfortunately, what happened just this past week is that the mom of my new cousin had a very sudden job loss. maternity leave and all that's off. So the family is, depending on Badger Care, which has been good for them, but the question mark is how long? And we received a really sobering briefing from the state DHS about what we can look for. And right now, just to keep up with the new regulations on Medicaid, and we're not even talking about cuts to benefits, it's gonna cost the state an additional something like $80 million just to keep up with things like work requirements, things like, and they haven't even published the rules, but they started the clock on penalties for making errors. So they've started the clock on penalties for making errors without giving us what the way to do this right is, so it's a setup. And so we're really looking for, we're looking at some big body blows to what the state has to contribute. And then looking down the line, the federal government is looking to externalize to the states costs of services that used to be paid for by the federal government.
Right.
And we're looking at, this is about a third of the state budget we're looking at that comes from the federal government to go into services. So the scale on this is massive. And, you know, I think that people just don't really realize that people who vote against Medicaid expansion, people who don't want postpartum expansion, they don't really understand that this is a million companies. This is ordinary, this is, you know, this is what we need to survive. We should not, under any circumstances, have moms that have just given birth be under this amount of stress. That how am I going to provide for my kid? How am I going to provide for myself? And what are these bills going to look like if I'm not getting the coverage that I need? So that is real time right now.
Let me just sort of, you know, I'm not trained at this, so you have to put up with this. Amanda, I saw you moving and looking some kind of way while she was talking. So that was my sign for you. Come on, you know, some stuff just works. Can you just share with us the complications that moms may have now, particularly when Representative Arnie set the situation up? People who were eligible for Medicaid, their income changes or doesn't change. What sort of hoops are they gonna go through right now? And I'm gonna ask some of the other moms who are entrepreneurs to tee up for a question I'm gonna ask you about whether or not you have the ACA.
And that's a good question, and it's probably one answer today and a different answer tomorrow. You set the stage really well. We have a lot of uncertainty happening right now. We know there are a number of new requirements, work requirements in particular, both for food share, but also for Medicaid coverage. And the federal government has given us little to no guidance whatsoever. So states are having to guess, and the deadlines for complying are coming up fast. And you know, the other voices around this table and in this room are gonna be able to speak to the reality of what it's like to do the eligibility paperwork, to do your renewal paperwork, to submit the variety of documents you have to submit on time and in the right way, sometimes you can elaborate on that with a level of detail that is both incredibly meaningful and real in a way that, you know, at the system level, the state level, would be much more informative and impactful than I can. So today we are tasked with trying to guess at what the rules are, what information do we need to ask from moms and families to get them coverage and to keep their coverage. We're trying to do that in a human way, and we are trying to do that in an informative way, and to tell people when they're going to be subjected to this new paperwork, these new rules, and what that means. And we are in this together at this point.
I'm going to ask the state senator here. are there funds that were set aside in the state budget anticipating, because I know there was a lot of anticipation about this move, in cuts to Medicaid. This is a hard time to be a state legislator right now.
It is, it's because honestly, Congresswoman, we know that there might be some dollars, but the reality is that we can't cover it. So as legislators, we are trying to figure out where we can push policy to generate more revenue for our state, but also still provide the very services that we know our constituents need. And so it's been working closely with, DHS, different departments, but also seeing, are there pockets of money? At first it was Medicaid, and now we're looking at SNAP. And so as legislators, we know that the states have become the front line to address some of these things that are coming down the pipeline. And it really is about where we put our dollars. And I wish that the budget that was passed this year included a little bit more of those provisions. It didn't. But I will give credit to where it's due. There was a postpartum bill that my colleague mentioned that did pass the Senate and is literally being held up by one person in the Assembly. And so this is where, guess who, Speaker Ross, we're just gonna name it for who it is. And so this is a horrible example of where you have politics getting in the way because someone wants a different, has different goals. And we know collectively that postpartum extension, funding for Medicaid coverage, especially for maternal health, are mechanisms that we know would provide healthier outcomes for so many mothers across our state.
If it seems like I'm jumping around, it's because I got the mic and I'm in charge and I can do it. I just want to hear from these three moms who are entrepreneurs, and to try to understand and help me, some of you all who are experts here, that if their kids are eligible for CHIP, Children's Health Insurance Program, that does not automatically guarantee them as entrepreneurs the enrollment in Badger Care. Is that right? They might be enrolled in the Affordable Care Act, and they will see. We didn't take up the expansion, but still, we have some reports on healthcare coverage where there'll be 35–40% increases in healthcare. I just want to talk to some of these moms and ask if you're on the ACA, if you would share maybe how your budget might be impacted by the premium increases in the Affordable Care Act. If that's what you are, how can you continue to be an entrepreneur and still have health care? I want to hear from you. Right on time, girl.
Right on time to ask questions. So, is it alright if I return the mic? That is not a,
You can return it.
alright, I apologize.
Okay, well, we'll listen to the other moms, that's okay. She wants to yield her time to the other moms. You can talk twice as long, speak up for her.
Well, I'm actually on Medicaid right now for me and my children, and as of far right now, it's actually helping for costs for our medical and our prescriptions. It is some prescriptions that are not covered that have to come out of pocket, but however, it is affordable for me and my children at this part of my time in my life. As far as entrepreneurship right now, I actually kind of had to stop some of those because it became affordable for me because of the income requirements. It started to allow me to now have to limit it so that I can be able to get the services that I need for my children. So as me being a mother, it is extremely hard to not be able to get the services you need to provide for them. So this part, that what we're going through right now, it is not only me being affected, but there's a lot of other women that are afraid to speak up, to say what they got going on, because postpartum depression, it is being overlooked. It's a silent treatment. I went through it. I didn't know exactly I was going through it until someone that I kept reaching out to my doctor, and it took me a couple of times to find a practitioner that actually understood. It's a lot of times when mothers, we will go to doctor's appointments and we are just a client. But when you get someone that actually understands motherhood too, and be able to understand and actually spend time with you, and be able to explain like the situations you have going on, and also to be able to explain why you feeling this way, and the things that you can do, and giving you, you know, options and alternatives to your situation. I finally got into a great doctor. She's my doctor to this day with me and all my children. I trust her. So to be able to have somebody to trust, that's what we have to go back to. People will be able to understand, to be able to be humanizing with one another. And it's not just a career. It's actually something that we all would need one day. If it ain't you, it's the people behind you. You know, we working for each other every day. You know, so coming from me as a mother, I'm just excited to be here. I just know that the services that actually is needed is really extremely important. And I'm just looking to see what's going to happen now. And our job is to speak up so we can see change. And I'm here to make sure that it does happen.
And so I guess I should ask how the work requirements will have an impact on the ability of these mothers to earn enough money to care for their children and yet not earn too much to be thrown off. What will come of them? I guess I should ask this question. I already bugged Amanda about this, but I might have to bug you again. Right, I'm gonna bug you again. What will become? Tell us about the paperwork. What is she facing? These mothers with regard to reporting in order to be able to maintain their eligibility on Medicaid as well.
Okay, so again, because we don't have guidance from the federal government, from CMS yet, I can't give you a clear answer. Like, I couldn't tell you this is how this is going to work when you come and enroll or you re-enroll. We just don't know yet. So we're going to have to, in short order, start making some guesses, and thankfully we have really good partnerships with other organizations, and we can reach out to our members to try and help us design that. You know, one of the things we do have is there are some work requirements in food share now. Those are expanding, and they'll become more difficult.
Yeah, food share, only 3 months eligibility in a 3-year period.
Right.
So you
So
gotta decide when to be hungry, huh?
yeah, hopefully it's not today, I guess. So I guess the specifics, we just don't know yet. And that's probably the hardest part, is when you're looking at some consistency for yourself and for your kids, for your family, and we know when there's consistency and coverage for a family, consistency and a provider is huge. Everyone wins in that family. You get better care and more consistent care, and it's more affordable care.
Well, fortunately, we have Rosa Maria Martinez from the City of Milwaukee Health Department here with us, the Director of Family and Community Health. She knows what I'm gonna ask, I'm sure. Huh? You anticipate, can you read my mind?
I don't know.
Okay, SNAP, the first phone call I got this morning, instead of my alarm clock awakening me, was somebody wanting to know, is it true that SNAP benefits are at risk as well? Can you share with us the impact on maternal health and SNAP benefits?
Absolutely. I can tell you that, so one of the programs that I oversee is the program. Yesterday I went into the office with the screeners, and I was not there but 2 minutes before I heard phone calls already, people asking, what's gonna happen with WIC? Am I gonna get my WIC benefits? Am I not gonna get my, do we know what's gonna happen with share? And these are very serious questions that you were mentioning, that consistency, that are really stressing our mothers out. The person who called had twins and was on special formula for her baby and was really, really concerned about, how do I know? And that uncertainty of not knowing is a strong impact. I can hear it in their voice. And not having access to food, I mean, you can only imagine that is incredible. At a time when I'm thinking about maternal and child health for various reasons, but if we think about the pregnancy, how complicated that can be. Sometimes we talk about it like it's a given, but there's a lot of complications that can happen. It's very complex and so many issues that happen, and that added stress of not knowing what food or how much you're gonna have can be very impactful to a working person. I did my dissertation on housing and pregnant persons, and honestly, I can't say how much. It's hard to even listen to some of the moms when they talk about that stress and what it means, because you're also at a time where the moms are being told, oh, you're a mom, you're pregnant, you can't be stressed because you're gonna hurt the baby. And so they're like going through those two things of being stressed because they're trying to have for their child, but at the same time trying to minimize that because they have the child in their body and trying to protect the baby. So very impactful in terms of access to food and the uncertainties to the families.
So, I guess the question that I have now, Kashana Franklin, and maybe even Ann Ledbetter from the 16th Street Community Health Center, a midwife, what impact do these Medicaid cuts have on your being able to deliver midwifery services, doula services to women? Full disclosure, I've reached menopause at this point, but I have 3 children. I have 3 grandchildren, all females, and 3 great-grandchildren, all females. This is just a hot topic for me. And I had 2 of my 3 children born with midwives at home. And I have legislation for doulas, and this team here are the sponsors of the Mamas Act here in the state legislature, so I'm like a big fan from lived experience with doulas. And how has the cuts in Medicaid funding going to impact that? I mean, just full disclosure, the United States has one of the most abysmal mortality rates for maternal mortality rates in the world. I mean, you think about all the hot spots in the world, Syria, Gaza, or Sudan, and just say the United States, women are facing as serious or more serious maternal mortality. Is a disgrace. And that's why we've thought of doulas as an intervention. So I would love to hear from our doulas and from 16th Street Midwifery. I have 2 children who were born with midwives.
So, at 16th Street, about 90% of our moms are on Medicaid. So we rely heavily on this program. And I'm on our clinic's quality improvement team, and one of the metrics we look at is moms who come for care during the first trimester, and we already have a situation where 1 out of every 4 moms is coming late for care. And when I talk to moms about why, a lot of what they tell me is, I didn't have insurance, I was worried about bills, I didn't know where to go to get insurance, there was all this paperwork to fill out. So I think we have to identify that the more barriers we put up for moms to get Medicaid, the more likely they're gonna come late for care or not at all. And that has so many downstream effects on the pregnancy. During pregnancy we screen for infections and we do ultrasounds, things that need to be done in a timely way. And when we can't do those things, we have worse outcomes in terms of, gestational diabetes, high blood pressure, the situations with mental health where it's really hard to intervene late in the pregnancy. So it's just so important that we have Medicaid access early in pregnancy. And I thank you. I'm So wonderful to hear that people have had great experiences with midwifery, and I'm gonna pass it off to our doula over here.
Right, I mean, I was so traumatized by the first birth, I said, have a baby, no way. Can't do this.
I'm gonna have to agree with what she said, that a lot of, women, when they have those barriers, they're less likely to go to the hospital. They're less likely to go to your prenatal visits, and even postpartum, when they get to postpartum, and you guys spoke about it, just having those, 60 days. And you talked about the mortality rate, but that also includes the first year of life. There's a lot of, the mortality rate for that is also extremely high. And there are complications there can be complications after a woman gives birth. And if they don't have access to healthcare, or if they have limited access to healthcare, they're less likely to go to the hospital, and that just contributes to those mortality rates. And as a doula, I am not medically trained, so there's only so much information or so much that I can do. So it is important that they still have that access to people who are medically trained.
Well, you're an advocate, which is important, and so I should ask the state legislators before I move on. You know, when you are deliberating on how to slice and dice the Medicaid funds, are you still gonna have the 60-40 match? You don't even know, right?
Well, we don't know. It's because, again, we based when, our folks on joint finance do the budget, we received 40% of funding from the federal government. And so with those cuts coming down the pipeline, I think that amount was almost more than half of our state budget. And so we would have to figure out, again, how do we even fund this? How?
And because this is something that's on the chopping block. I mean, 46% of Medicaid funds are spent at the nursing home. We're not talking about that today. We love our seniors who want them to get good care, but we're working with less than half a loaf here. So this is at risk. So this is not a mandatory service, right? Up to age 1, which you talked about. There's suicidal ideation. Oh, I remember I had the visiting nurse come to visit me. I was 18, the ripe old age of 18, when I had my first baby. And she taught me how to put a diaper on. I didn't know how to do that. My child had an asthma attack at 4 days old. Some of the first people that I needed in my life were medical folks. I guess I want to hear from Planned Parenthood and your operations. When I found out I was pregnant at age 18, found out my first medical exam through Planned Parenthood. But a lot of care. I went to Planned Parenthood. I didn't have a primary care physician, a relationship with a doctor. I went to Planned Parenthood, and I have treasured those services forever and ever. I mean, people get referrals because they have suspected cancer, diabetes. Some people find out that they have high blood pressure because of their visit to a friendly environment. And so I want to hear from Planned Parenthood, I guess, about how the Medicaid budgets impact you.
Thank you for that question, and thank you for being such a champion of the work that Planned Parenthood does, Congresswoman. Planned Parenthood is already impacted by this bill and by the Medicaid defund. And what I mean by that is there was actually a specific provision in the big beautiful bill that was passed this summer. There was a specific provision to take away funds for Planned Parenthoods, and Planned Parenthood of Wisconsin had to make an incredibly painful and difficult decision just about a month or so ago to end abortion services, because if we hadn't done that, we would have been what was considered a prohibited entity, which would have disallowed us from receiving reimbursement for Medicaid services. The covered services we provide, to be clear, abortion is not covered by Medicaid. To your point, Congresswoman, Planned Parenthood is really there for people in their entire reproductive lives. So our goal is to make sure people are healthy before they decide when and if to have children, and after they decide to have children. And we are often their first touch with the healthcare system and can be a door opener to other providers or other specialists that they need. So it's not only that people aren't able to access our services if there was, if this Medicaid defund had gone through, or if there is a reduction in the number of people who are able to receive Medicaid, which there certainly will be with all of these new work requirements, reporting requirements, and the onerousness of that. They not only will receive services, not be able to receive the family planning and sexual and reproductive health care services at Planned Parenthood, but they will very likely just forego any kind of medical care and not detect cancers early on, not detect STIs and receive treatment for those things. So it's really a devastating impact. And just to give a little bit of perspective, in Milwaukee County, 70% of the patients that we care for rely on some kind of Medicaid. So that could be Badger Care. There's also something called family planning only in Wisconsin, which is a very robust form of state Medicaid, and that is for certain family planning services, which includes birth control, other types of contraception, STI testing, treatment, pelvic exams, well, women's exams, etc. And that actually, after decades of work, has expanded to a little bit over 300% of the federal poverty level in terms of eligibility. So, and that is a 90-10 match from the federal government. 50,000 people in this state come to Planned Parenthood every single year for these services, and across statewide, 65% of those folks are covered by either Badger Care or family planning only. So it's just already, we're seeing such a devastating impact of it.
Well, somebody sent me a note, I don't know why, because that obviously takes us to the doctor on the team, and also the county board supervisor, and his director, Director McLean, Shakita McLean, who's here. I would just want to say Shakita McLean is Director of Milwaukee County Health and Human Services, and they have a $400 million budget and more than 700 employees. Really, how are you going to spread these funds thin? And also, Doc, I want you to address some of the stuff that we've talked about with maternal mortality and lack of good health care and the lack of abortion services and the impact that you see people every single day in every stage of pregnancy, postpartum. We want to hear what the consequences of not having Medicaid are, and I want to hear from you, Shakita, how you're shaping and prioritizing your funding based on these cuts.
Shakita, want to go first?
Yeah, you guys work together. We do work together. That's why I got you guys here.
Well, this is a topic that is dear to my heart. So it's dear to my heart because I'm a mom, and being pregnant with my last son at about 40 years old was just a different experience from when I had my older son. I was 18 at that time, just like you. And I also used Medicaid at that time, which was very beneficial. But even when I did have Medicaid, it was hard. Maternal health was just hard. It was different, trying to get my needs met, my feelings. You think about during that pregnancy, how you're feeling, all those things. It was not playing. I was going to get my tubes tied and found out I was pregnant. That was a whole devastation for me, right? And so those kind of things we don't think about. We talk about maternal care, the before, the during, the after. The mental health piece is really critical. A couple months ago, we partnered with the Milwaukee Healthcare Partnership, and we also had the Medicaid director, Bill Hanna, and we did a session with our providers at the Zufari just to talk about some of these changes that are going to be coming up and what do we do. And while many of us are saying we don't know, right? We don't know what those work requirements are going to look like. What I have really challenged my staff to do, we're meeting weekly, we're talking about
how do we have boots on the ground, right? We have that new Health and Human Services Center, and we talk about it's more than a building, it's a lifeline. Well, that's work, right? That's just not the talk, that's the action. And so making sure that we have partners like Milwaukee Enrollment Services who help determine eligibility there, that we have our benefits specialists there, that we all are learning about what those work requirements are going to be and what the exemptions look like, and how do we make sure that we are, it is going to be about educating people, right? Because right now everyone is anxious. We're anxious because of the unknown, right? And so what we have to do is make sure, usually when people are thinking about having suicide ideation or feeling helpless or hopeless, it's because of the unknown. We don't know what tomorrow is going to be. And that is our job to make sure that we are saying, listen, today we don't know, but what we're going to do is walk with you through this process. What we're going to do is make sure that we're going to have our staff knowledgeable enough to know, making sure they're going to all of the meetings, making sure they're going to the workshops and the webinars, making sure that we just applied to be on one of the Medicaid advisory councils, that we have boots on the ground out there and hearing about these changes as they come about. And while we have to be realistic that these changes are going to have an impact, and what we have our birth to 3, right? So children we serve from birth to 3. Well, those moms are new moms. And now if you have a child that may be dealing with disability, that's something else on top of that, right? And if you have work requirements for these moms now who need to be home taking care of their kids, that's something else that's going to be an impact. Are we thinking about that? So we all need to be thinking about the work that we're going to do, how we're going to do it right now with the food share. We're putting together the list. I see so many people putting together the list. What other pantries out there? How are we going to partner with folks? How are we going to get food to the people? This has to be a community solution. Yes, we want Medicaid to be expanded, right? We want it to be for the year. Yes, we should continue to push the policy. But also, this is a time that all of us as partners, all of us as community, we're going to have to step up, step in, step together, walk together. This is going to be the work. And so that is what we're talking about, and that is what we're going to continue to do, is make sure that all the services, from our children's long-term support waiver, from our behavioral health services, from our birth to 3, that as those mothers are coming through, that we are making sure that we are educating them and that we are walking alongside them as we all are trying to figure out the unknown.
Okay. Can you tell us how you really feel?
This is why I like working with Shakita LeGrand. This is exactly the passion that she brings to the equation. And also, I'm so happy that, I'll just say his name, County Executive David Crowley picked her because of what she does. And what she does every single day, not only for everybody in Milwaukee, but also the Milwaukee County Board of Supervisors. She also helps us a lot. What's going on in the trenches in obstetrics and gynecology is really, we're in a huge sea change taking place in Milwaukee and in this country. When you brought up Planned Parenthood, what's going on with them? They're the first branch. They look at the STDs. We have a crisis. We have one of the highest gonorrhea rates in the entire country. Is that something to be proud of? Chlamydia rates, trichomonas rates, STDs. Nobody wants to talk about STDs, but damage done to young women. Men get off lucky on this thing. Biologically, they don't suffer the consequences. But when a woman receives gonorrhea one time, she has a 10% chance of never having a child for the rest of her life.
Wow.
2 times, 30%, 3 times, 50%, never having a child.
Right. Wow.
It's absolutely tragic. So STDs have real consequences, lifelong consequences, and they cost money. The pain, the suffering, the emotional toll it takes, dramatic. Planned Parenthood is usually the initial screener. It's critical. Medicaid should be paying for these things. Another area that's really becoming a major problem in this country is obstetrical deserts. What I mean by that is the closing of labor and delivery rooms across this country. Not only in Milwaukee, just in Milwaukee, we lost St. Francis.
Yeah.
We lost Elm Grove, Elmbrook's gone. We lost Ozaki, Grafton's gone. We've had changes in where people deliver their babies. I mean, here women are, I look at 16th Street Clinic. For years at Ascension, now they're already at Aurora. Physicians who are really with one organization gone with somewhere else. This causes stresses in people's lives. This causes real problems. Where's my doctor? Where did she go? Where did he go? Where do I go for care? Basic levels. The support of doulas is critical. I'm a hardcore supporter of doulas. I think the African American community with lactation and coolant absolutely homegrown, delivers real care, and they should be supported. I think midwife community, across the board of all midwives, I strongly support them. And they should be included in hospitals and outpatients, and we should endorse their care, and that we should respect them. And women who go for care to a midwife, and all of a sudden they come into an obstetrical physician of this community, they should be treated with respect and not hostility, which they are suffering daily. This is not the time for stress, this is the time to support. So, and then the last part, when you get to the postpartum care, it's absolutely criminal to say that the state of Wisconsin does not want to have 1 year of coverage, where almost every other state in the country covers throughout 1 year. It's wrong that one member of our legislature says, I'm not dealing with that. And I hate to say it, he's a man. A man should not be telling all these women in this country, in this state, no, you can't get care.
Okay, that's what I have to do. Let me ask you something, guys. When we look at the high maternity mortality rate in this country, is it due to people not having postpartum care and the suicide rates are preventable?
It's definitely a component of it. It's definitely there. There's something wrong in this country when African Americans die at 2 times the rate of a white person in that maternity, full setting of maternity care. When that woman does not have a chance to call their doctor, call their midwife to say, hey, I need help. Where do I go? I'm not feeling well.
If you had a doula, they'd be tracking it.
That doula is going to come.
You put yourself down for not having medical background, but you're there. That's the thing. You are there. You know when people are depressed and when they can't, go on. And you were saying you didn't even realize that you had postpartum. You didn't know what it was.
Yeah, I didn't know for a while. It was to the point where if you ever had a moment where every time that you thought about doing something and you start beating yourself down, or you start having these emotional feelings of where like the things that you used to do on an everyday basis you don't do anymore, and it's much harder to get up to do those things now than it was before. I didn't notice that until I had one particular friend. I've been friends with her for 22 years.
Your doula.
Still to this day, she. Matter of fact, I'm gonna have to call her my doula because she has definitely been there. She came to me and she said, "Hey, can I offer you some advice?" And I said, "Sure." And she started to tell me that you having sort of, symptoms of postpartum depression, and she said postpartum, and then it started to lead into depression. And I said, no, not me, I started to tell myself, no, that can't be me, because my pride was just too high. I knew for sure that couldn't be me. So I started doing everything opposite of what she told me and tried to make myself feel that it wasn't me, until one day I had to finally get that support from her. I said, look, it's okay. It's okay you're going through this. This is my job to help you through it. And when I got that, it started to help me along the way of getting that care. And so then she started pointing me in directions of where I should go and who I should talk to. So then when I did start getting these care, some of the people that I went to wasn't very supportive, because a lot of people don't have the background or the understanding of what I'm actually going through. So if I'm telling you something, don't just push me off because you never experienced it. So I started doing more research of trying to find people that actually had the experience in it, and it made a change. So I think that, this field for where I'm at, if you don't have somebody to go to be there to support you, it's a lot of people that are lost. A lot of people that we all think that, hey, we should just know. You only know when it's told to you, or you only know when you actually fully experienced it so you can tell someone else. But for somebody that has never went through it, they don't have the resource. So we need to, it's a lot that we going through on a daily for mothers, and be able to have these agencies. I'm looking around the table and I'm sitting here next to you. And I realized even for Planned Parenthood, I was one of the mothers, my first child. I got pregnant at 21. I didn't want to go to the doctor, so I went to the agency. And the agency helped me along the way, again, provided me to go to, gave me a referral to the OBGYN. Giving me those things. So I have to trust somebody first, and your agency was my first. So, so I'm just here to support and know that everyone around this table, whether you know it or not, you guys make an impact to every mother that's out here with babies. And I'm like, just like you said, I'm out here wanting to put boots on the ground as well to be able to make sure that, hey, we need this change to happen, and we don't need any cuts or anything. If anything, we need more support, because how the way the economy is going now, a lot of things are already happening. We get cuts like this, what else is going to happen? Everybody's having a lot of stress, and there's a lot of mental health going on. We cut out where now moms don't have the resources to do it. Now we have even more people with more mental health than what we have right now. So that's my scare, is what do we do when we have the women that, don't get me wrong, men, women, we do more when it comes to when it comes to households. Majority of the time, it's the mothers that are nurturing and supporting the child. If we get mothers not being able to do that, then who takes care of them?
Amen. I'm going to try to sort of summarize to some extent what we have heard here today and celebrate. Let's thank all of our panelists right now. It's been very deep. Medicare is called Badger Care in Wisconsin, and Wisconsin's Medicaid program covers about 20% of Wisconsinites overall, including 40% of all births, 40% of kids, 60% of people living in nursing homes, and that would be Badger Care plus Children's Long-Term Support Program, Family Care Partnership, Family Planning Only Services, IRIS and PACE. And unless we do something, there are about 276,175 Wisconsinites who are going to lose coverage under the Affordable Care Act and Medicaid under current law. So people have said, what are Democrats thinking when they don't want the continuing resolution as it stands to pass without discussions of the 15 million people at a minimum who will lose health care and 276,000 Wisconsinites? This is what's at risk. This is just one element of what's at risk. We need a whole different discussion about the elderly, which you oversee, and the disabled group of people. And they're gonna have to fight over the 40% that's left after they make these cuts. Because 60% mandatory must go to nursing homes. What will we do? Well, I am happy to announce that we're starting to build a consensus around this. Americans are suffering right now because of the shutdown, but they're beginning to see what is on the table. We are not going to be bullied.
That's right.
Into throwing people off healthcare, bullied into stopping entrepreneurship, bullied into not being able to reduce maternal mortality. We're not going to be bullied into seeing cuts in community health centers. We're not going to be bullied into having people not be able to pay for prescription drugs. We're not going to be bullied into it. We're going to force members of Congress to come to the table to address health care, which is 25% of our economy. It's not just the people at this table who will be impacted. It's our entire healthcare system. We've heard today about hospitals closing their maternity wards, merging services. It's not just maternal health, but it's cardiac services and other services. You know, calculation from the CBO is that, you know, about $25 billion in uncompensated care that hospitals will endure the impact of this bill. Hospitals are closing. Urban and rural hospitals will suffer. And, not only that, but there is a provision in the One Big Beautiful Bill, the One Big Bounty for Billionaires, I said, where we have triggered a $500 billion cut in Medicare, along with the $1 trillion cut in Medicaid, as well as the Affordable Care Act premium tax credits not being renewed, where entrepreneurs and people who were on the Affordable Care Act because they weren't eligible for Badger Care, but they're not being funded by their corporations for health care, will find themselves with premiums that double in many instances. Not only that, those people who think that this doesn't have an impact on them will see their premiums rise. Open enrollment period is right around the corner. November 1. Wait on that email from HR saying, hey, we're going to have to increase your share of the healthcare premium. So healthcare is a huge part of our entire economy. So you can't just say, we're going to punish that little white boy in the basement playing video games, playing and calling up the stairs and saying, Mama, give me some more potato chips. This fictional person. That fictional person is 276,000 calculations. I want to thank all of you, and I want to offer panelists one more second to just give us some hopeful words. And my hopeful word, before I pass the mic, is no lie shall live forever. Is that healthcare is something that is unifying every single one of us. Are there questions from the press? You can direct them toward any of our panelists. Boy, this is the smartest. Okay, come on. Please identify yourself.
Absolutely. Hi, everybody. My name is Michelle Wilkins. I am with the African American Breastfeeding Network. Mine is a mixture of a story as well as questions for everybody that's up here who want to put their input in. Currently, I am experiencing a miscarriage. This is my second one this year. And my doctor has given me a lot of different scenarios of medications to take to try to remedy the situation. I had to look her in her face and say, I don't know if you heard what happened, but they're cutting everything. I don't want to sit here and try all of these medications. I need the surgery now. And that was just more from a space of uncertainty about whether I was going to have health care the next day, or if I had to choose between something that can literally cause serious harm to me and my future, with having kids in the future. To individuals up here who are involved in the community and have experienced other individuals or clients that you have worked with in this space, how are you providing services to uplift them in this uncertainty so that they can continue to make the correct decision out of impulse, but also considering their safety as well as any future decisions as well?
I'm not a doctor, but I will say this. She just has given us a definition of reproductive health that is, people often think it's just about abortion, just about giving birth, but it's also dealing with her medical condition and enable her to maintain pregnancy. This is a whole spectrum, and this is what's being interrupted with this legislation. And of course, I see somebody leaning forward here, because they're the only person on this panel with any qualifications to answer her question.
First of all, my deepest condolences on your loss. My heart goes out to you during this terrible period, and for you to stand here with all the strength that you said was really, it's very admirable. So I wish you. But you bring up several points. First of all, I think the most important thing is you have to find somebody who's empathetic and caring, who can take care of you during this time. And if your physician can't help you and you don't feel you're getting heard, you find somebody else. You know, doctors receive a lot of money seeing patients, and you know what? When you go to Walmart, they greet you and they treat you nice. You go to McDonald's, they ask you, do you want French fries with your order? They treat you nice. If you have a doctor who's not treating you nice, you go somewhere else. Take your business somewhere else. They're not, you know, it's just bad. Go somewhere you're listened to. The other concern you bring up is what do you do? And we are having a huge problem on medications right now in situations like yours. We can't give out misoprostol. They're saying it's an abortion drug. We can't use mifeprex. We can't use that. Oh, that's another abortion drug. But it has real implications in people who are having miscarriages. So they're saying, oh, this drug, Medicaid's not allowing us to use those drugs. Pharmacies are banning the usage of it, or they ask you the question at the pharmacy, going to Walgreens, and there you are at the counter. What are you using this drug for? That's none of their business. It's wrong, and there should be a law, a federal law that bans these questions. It's wrong what's taking place, and it's being done to women day in and day out in the most sensitive situations. It's wrong, and these are laws that should be on the books to ban these type of questions. So I think the first thing right now, most immediately, my condolences, but find a doctor who can help you.
You're already here. Come on, girl. Beautiful.
My name is Tamara Thompson.
Well, Tamara, come on, take the mic.
My name is Tamara Thompson. I am here with the Wisconsin Doulas of Color Collective. The Wisconsin Doulas of Color Collective is a big reason why there is a pipeline from doulas who become midwives. And as you said before, there is a spectrum of midwives. A large number work in the community and outside of clinical settings. So there are midwives who work specifically in the Amish community, and there are midwives who work in neighborhoods, right? And so my aspiration has been to become one of those midwives that works in a neighborhood. People know where I'm at on the spot, right? One of the things that I'm noticing, and one of the things I want to ask, is how, as we, boots on the ground, are not able to receive funding as independent care providers or nonprofit owners. We can't write grants like we used to. We can't ask for partnerships like we used to, right? So in those types of ways, we are even seeing people who choose to have what we call a free birth, where they go home knowing that they're in labor and stay home, and they choose to give birth. They don't register with an OBGYN, and we can see that this might be a sovereignty thing for some people, but this is something that a lot of people wouldn't choose had it not been for the barriers in place for them to get respectful, affordable care that is actually seeing them as the person that they are, right? So for boots on the ground, midwives and doulas, lactation counselors like myself, what can we expect from institutions, right? Hospitals, clinics, and things like that to support us in our work?
We actually, I'm gonna pass the mic and then I'll yield too. We have our state senator and our state rep here, and we can tell you what work they're doing and what work we're doing on the federal level as well.
To me first. So thank you for your question. I know that you've done amazing work. The state honestly has just put funding and allowed the capacity for work that you guys do to get paid. That's legislation that has to be passed and it hasn't yet. So that's something where at the state level, that's where our partnership needs to come in, and we take ownership of where we stand responsibility for. I do know that they're not here today, but Representative Stubbs and Senator Johnson have done similar work. They've introduced the Birth Equity Act in years past, and I believe they're working on that again. So that's, again, uplifting resources to ensure that there's equity when it comes to birth outcomes and all the providers involved. And I mentioned it earlier, but Representative Arnie and I are currently working on a state version of the Mama's First Act, reflective of Congresswoman Gwen Moore. And again, it's to ensure that doula services are accessible to more families by allowing Care, which is our Medicaid reimbursement for certified doula support, and to be working with DHS to allow them to seek necessary waivers or amendments to ensure that, again, as all the things that are happening with uncertainty with maternal care, that we are ensuring that we are prioritizing services and options for maternal health, especially for our doulas and lactation support systems and what have you.
And one more thing that's really important and I want to lift up is part of this act is requiring private health insurance to also pay for doula services. And as our Medicaid system is getting all these shocks, I want to point out that Wisconsin has a lot of small insurers. It's Wisconsin and like the state of New York that has the best competition between insurers. So I encourage people to take a look at things like, I believe it's Common Ground, things like what would it be like to be part of the Affordable Care Act. There are things that we might, it's going to stretch us to start thinking a little differently. I also want to lift up Independence First and the disability rights organizations. People don't know this, but when you are postpartum, you are temporarily disabled and you might have eligibility for certain services. It just has to looking for those things in different places. So, in fact, that's something that I brought up from my cousin. It's like, oh, Independence First has some of those bars that you can put in your bathroom because you're not going to be moving around very well, for equipment, for other things, and also just for another way in to some of those resources and services. And, I want to say too that the backbone of everything is really one another. As you pointed out here, that it really is about making those connections to people and making some unusual connections too. We're thinking about how to lift up and address how do we get more people donating food, not just now, but sustaining that donations. There's community refrigerators that are coming in, I know in the Metcalf Park area, if you're aware of Triple B Cafe. Some of these small things now are gonna have to grow up and get bigger and blossom, because it always comes back to mutual aid. Everything, Medicaid grew out of mutual aid. I mean, it always comes back to mutual aid, and the benefit of these times of great disruption is that they cause us to go back to the root causes. We shouldn't be talking all the time. I mean, we should be talking about it, but we should be envisioning a post-Medicaid world where we have universal health care, like Canada does. And how do we get there? Because at some point, this energy needs to go into what do we need? How does our government, how do our shared resources get used for our common good? And get back to that and not give that up. Not get discouraged, but to push out with this energy, because that's how our ancestors got us to where we are today. Medicaid is new. Medicaid hasn't been around forever. What's the next version?
Amen.
Just one more question, Congresswoman. This will be our last question.
Okay, thank you. Come on down.
I'm Maria. I'm a women's health nurse practitioner.
Can you just use the mic?
Sure.
They're making me do this.
I was trying to do this. I'm Maria. I'm a nurse practitioner at Progressive Community Health Center. It's a federally qualified health center with Dr. Tully. And I work in our OB/GYN department. And I hear you guys talking about all the advocacy you're doing. I just wanted to ask if you'd be advocating to continue with the program that people who are on Medicaid get rides to their appointments, so they go because that's a really important thing that keeps our patients coming to those appointments. And just like the doulas that we talked about, our community health workers are really, really important because they do the prenatal care coordination. If someone's missing all their appointments, they'll call them multiple times and get them scheduled. they're the ones who find out they don't have a ride, and then help them apply for the free rides. So those are two really important things, and I just wanted to verify we were working on that along with everything else.
Honestly, that is one of the things, the items that I fear the most, is loss of transportation and medical appointments. You know, as these state legislators face what to prioritize, as I indicated before, and I just looked up the data, you know, more explicitly, 60% of whatever Medicaid funds are available in the state will have to go to nursing homes. There's no debate about it. There won't be any legislation or lobbying or anything that will change that. And that leaves 40% of, you know, with all the questions about, I think the Wisconsin legislature, they were real smart. They passed their budget minutes before the federal government. I know, because they called me up, you know, saying, isn't there a 48-hour, 72-hour rule? I said, you better pass it now, because they're waiving there's no regular order here. You know, in order to be able to get the provider tax credit, to be able to pay for some of the Medicaid, as our legislators have already told you. So thanks for your advocacy, because this is just one of the many things that is going to be an issue. County, this is sort of in your wheelhouse, right?
I mean, we do some of the transportation for our older adults, so we do provide that transportation, but to medical appointments and things like that. But this is a big advocacy point that we continue to advocate for, so I agree, for families as well, right? Get into appointments. We get a lot of the calls that come through our Aging and Disability Resource Center just around transportation to medical appointments, so this is an area that we will continue to advocate for.
That wasn't lost. And what about appointments to dual eligibles, I mean, people who are going to dialysis? Is that funded through you?
We provide it through some of our aging transportation, but not for everyone, right? So that is something that we need to make sure that we continue to advocate for.
Right. Is that it? Okay. Thank you for that. I got a note here, very important note for the audience. It says, tell everybody to take a cookie as they exit the room. Any other burning thoughts? We don't want to leave the room with people who have questions on their minds or things that they're just dying to tell us or share with us from our panelists. Oh, great. I know. Amen belongs right there. So have a last word.
I just want to speak to our commitment. I think everybody here spoke to their experience, their engagement, the importance of working together and being aware. And you know, I've lost a child, and it took me 20 years to do what you did today, Michelle.
Oh my God.
To talk about, you know, the loss of a child. And I think that right now our infant mortality rate is the goal for Healthy People 2030 is 5.0, and in Milwaukee, it is 9.4. So we're almost twice that rate. And if you look at certain zip codes, it is even double that. And it is a terrible, it's never a good time to take away health insurance, but it is sad and it is disturbing. And it will take all of us to work together to do what we can. And so unfortunately, it is not a good time for us to have lots of programs, but I think it'll help us think outside the box. And I think that's what we need to do, is think outside the box. Stick together, work on this, be aware, engage with the community, continue to the continual quality improvement of our work, and just constantly be aware of this change.
Thank you all so much. Give yourselves a hand. I just want to end this by pointing out that my district director, Maria Ayala, is here with us today. The man at the camera back there, Robert Hanson, who's also a school board director for Greenfield. Leon Cannon, who's a legislative assistant. also a full-time student at UWM, so he's just a working man. And Jacqueline Jones, is in our office, and anybody who wants any, information, we have information on the impact of the federal budget, reconciliation bill on Wisconsinites, Medicaid provisions. Be sure to give us a buzz at 414-297-1140. 1140. Right, I never called that number actually. Thank you all for coming, and you are dismissed.